The law's the law. We all of us need to follow the law. The law's been very clear on this.
Dozens of new mental health A&Es are going to be opened across the country. The government says it's the biggest redesign of mental health services in a generation. There'll also be new specialist centres on high streets to help people get support earlier and closer to home. Yvette Cooper is the new-ish Health Secretary. Joins us now from Sheffield. Yvette, morning to you.
Morning, Stig. Hope you're well.
Very good to speak to you. Tell us how this will work in practice. I think lots of people are interested in this. If someone is feeling mental unrest, if they're feeling anxious or overwhelmed, will they simply be able to just show up somewhere and be treated?
Well, they actually will be able to walk into these new centres, yes. And this is the biggest redesign of mental health service delivery for a generation. We're setting up these new community centres, 100 new mental health community centres like the one that I'm here in Sheffield today, and also 59 additional mental health emergency departments as well for those who are reaching crisis who otherwise might end up in the main A&E, which just isn't appropriate as well. So look, most of the services are going to be designed for the most serious mental health conditions, but it does also mean that people can just walk in and get support and be really made sure they can get to the right place and get the right kind of support for their mental health needs.
Would you encourage people to do it? I mean, 'cause I'm sure you'll be worried about this being overwhelmed as well, but if someone's feeling anxious, which is a serious thing, I don't want to in any way downplay it, but many people live with anxiety as well, would you encourage them to walk into a centre and go and talk to someone about it?
Well, probably the most appropriate thing in certain a case like that and those sorts of anxiety issues is going to be the NHS talking therapies. So in those cases, then you'd want somebody to be referred to the NHS talking therapies, and therefore that might be the best thing to do, might be to go to the GP. But look, I'm not a doctor, I'm the Health Secretary, so what I'm not going to do is to give people advice on any individual clinical cases, but actually the GP may well be the right place to start to get those talking therapies and to get that kind of initial mental health support. So mostly these centres are going to be designed around people with the more serious mental health conditions who may need ongoing support. But the point is, because you'll be able to walk in, you'll be able to get guidance, support, advice as to where you need to go to make sure that you can get to the right place. And look, at the moment, we've got all of these different mental health teams all working separately, often a lot of fragmentation, not working together. You can have people really passed from pillar to post, not getting the support they need. The evidence from these centres, the small number of centres we've been piloting, is that they've been doing a really good job and providing the kind of support mental health patients need.
There are thousands of clinical vacancies currently across the NHS mental health trusts. Have you checked? Can you guarantee there'll be sufficient trained psychiatrists, psychiatric nurses, the right people in place by autumn?
Well, we've been increasing investment, we've been increasing the service provision, including mental health staffing. But crucially, what these centres are doing is bringing together existing teams who often don't actually manage to work together. And so that's what we mean about people being passed from one team to another, not getting continuity of support, not getting the same support from people.
So you don't need new staff, actually, you're just going to put staff in the same place?
So one of the things we're doing is actually exactly bringing staff together in the same place, but also alongside things like housing advice or things like the voluntary and community sectors, who can provide a lot of support for those with mental health difficulties and challenges. If you bring everybody together, they're able to work together much more effectively and also provide support much more effectively in a safe place for people, in a familiar place. So this is about doing services differently. We often just talk about this only being about funding. Actually, a lot of this is about how we deliver services in the most effective way to deal with some of the rising mental health problems that the country is facing.
There are other health issues around today. The EHRC code, which covers single-sex spaces, came into force yesterday. I'm interested in what this means for the NHS. What will the rule be for trans women, so someone born biologically male, when it comes to access to single-sex wards? What's the NHS rule when it comes to trans women?
Well, we'll follow the law. and follow the ruling. There's going to be advice, more detailed advice published shortly, and guidance for the NHS, but the law is clear about ensuring that if there are single-sex provision, then that has to be on the basis of biological sex.
So that will be true for us. Just to be absolutely clear about it, a single-sex ward, someone who identifies as a woman but was born a man would have to go to a male side of the ward rather than a female side of the ward.
Well, the guidance will be set out shortly to make sure there may be people who will need the additional provision or additional arrangements made, but it's very clear that where there is single-sex arrangements in place, it needs to be done on the basis of biological sex. So we'll set out that guidance shortly. I think that's due to be published in the coming weeks.
Some left-wing councils, including Labour ones in London, want to challenge this guidance. They've written a letter affirming that trans women are women. Would you say they are right or wrong? Would you be able to say that they are wrong then from what you've just said to me?
The law's the law. We all of us need to follow the law. The law's been very clear on this.
The Times has some interesting research this morning about possible side effects of weight loss medication. This falls under your bailiwick as well. It found that patients in the UK have filed hundreds of thousands of reports of adverse side effects, with more than 100 deaths linked to the drugs. Are you worried about this as Health Secretary, that there just seems to be rising concern about the impact of weight loss medication? I'm talking about things like Manjaro.
Well, there has to always be a proper safety assessments done. There has to always be a sort of the medical health regulating system makes sure that they follow any safety, any adverse effects, that they keep that under very close review. As you'll know, all drugs have to go through extensive trials in the UK before they are licensed for use and before they are recommended, and also to make sure that the clinical circumstances in which drugs are being recommended is right, and also any adverse reactions are properly monitored. It's for those experts to ensure that they keep that monitoring under close hold, and also to provide us with advice. But I obviously expect advice to be provided to me about any safety issues on any conditions or drugs.
I don't know how hot it is in Sheffield today. It's going to be hot in the south for at least another couple of weeks. How worried are you about heat? We know about the winter crisis. As the Health Secretary, you'll be about to have your first winter health crisis in a couple of months' time. Is there a danger of a summer heat crisis?
Well, the NHS is going to have to deal with summer pressures now, and I've talked to some A&E staff who were talking about how they'd seen increases in the number of people arriving in A&E in the summer in a way that you would normally only see in the winter. And heat does have an impact. We've had heat health warnings that have been issued in different times in different areas, exactly because of the impact it can have on those who are frail and elderly and vulnerable, but also on the very youngest children as well. So this means, first of all, we're going to need to have stronger preparations across the NHS for the summer in the way that we do for the winter, to ensure that across the NHS everybody is ready to respond. And there's a lot of determination across the NHS to make sure that we can do that. But we also need that prevention support and advice as well. And that means all of us looking out for neighbours who may be elderly, frail, or maybe vulnerable in the way that we would in the winter. We're going to have to start doing that in the summer as well, as we've seen these heat waves continuing.
Can you commit? We had people who work in the NHS say they work in places where you can't turn the radiators off in the summer. So you have places in the NHS with no air conditioning. But worse than that, the heating is on 24 hours a day, 7 days a week. Would you look at that? This is an infrastructure point about the NHS. Can you look at that to make sure that doesn't happen in the future?
Yeah, look, some of the infrastructure that we have in our NHS has been there for very many decades, and look, these weather conditions that we have seen change in recent years. So things around cooling, around making sure that you've got appropriate airflow, you've got appropriate conditions, that is part of the capital investment and the capital investment programme now. And as we look forward over the next 10 years, may need to increasingly be part of that capital programme. So of course it's something that NHS trusts and the department is looking at across the board, is how you make sure we can adapt, how you make sure that we've got the modern conditions. But this is something that all organisations are having to deal with, and shows actually how seriously we should take some of these climate change pressures.
Yvette Cooper, good to speak to you. Thank you for joining us.